Yeah, she started
Yeah,
this.
yeah.
Good luck, Dia.
Can you see my screen?
Yes.
Okay. So hi everyone, I'm Dia, and today I'll be presenting my research on how income inequality and other structural forces shape mental health across G20 countries. Uh, so rather than looking at mental health in isolated countries or in short periods
Yeah,
of time,
one second.
this
Yeah. So, can you also introduce yourself? So you're at
oh
you.
oh yeah, I'm a junior at University of Illinois at Urbana-Champaign. Um, yeah. Is there anything
No,
else?
and you're pursuing a BS in economics. Okay.
Oh, yeah, I'm doing a major in econometrics and quantitative economics, and I'm doing minors in statistics and health technology. Uh, okay, so I'll get back to the presentation. Yeah, so this project, it takes a long 30-year view and asks a simple but I think important question, which is how do the conditions that we all live in, economic, social, and environmental, how do they accumulate over time to influence population mental health? Okay. So mental disorders now account for a major share of the global disease burden, and the G20 countries play a very large role in that trend. But at the same time, inequality has grown steadily, shaping people's daily experiences, their stress levels, and access to services. But when we look at the existing research, we realize that most studies aren't capturing the long run dynamics. So they usually focus on one country or on one specific moment in time, which makes it hard to see how these forces build up and interact over um, decades, even. So our motivation was to kind of zoom out and to look across decades, across various countries, and across multiple types of disorders also, to understand the bigger structural picture. Yeah. So there's a lot of mechanisms that help explain why these structural conditions matter for mental health. Some are material, which are basically things like job security, income stability, access to care, and all of these, they shape your everyday stressors. And others are more psychosocial, so in more unequal societies or where people experience more comparison, more uncertainty in their day to day, and more pressure, which increases their psychological strain. Uh, we also considered social cohesion, which is basically how connected people are and how supported they feel within their communities, which weakens when inequality is high. And the last one was environmental exposures like air pollution and urban density, which have been shown to influence the brain directly. So together, sorry, these four pathways, they help us understand why these disorders might respond to different structural pressures, and they also give us a lens for interpreting the results later on. So yeah, the literature, it gives us several pieces of this puzzle. For depression and anxiety specifically, the studies repeatedly show links between inequality, stress, and feelings of insecurity. Economic shocks like unemployment or even recessions, they clearly worsen mental health, while stronger economies tend to support better systems of care. On the social side, there's higher health spending is one of the most consistent predictors of improved outcomes. Gender inequality also plays a huge role by shaping exposure to stressors, risks, and also barriers to care. And environmentally, there's strong evidence that urbanicity and exposure to pollution increases the risk of disorders like schizophrenia. But what's missing in all these studies is that they only look at all these dimensions together is that they don't look at all these dimensions together over multiple decades, which is the gap that our paper hopes to address. So to study these relationships, we put together annual data for 19 G20 countries from 1990 to 2021, so about 30 years. Our mental health outcomes come from the Global Burden of Disease dataset, which they provide the DALYs for depression, anxiety, bipolar disorder, schizophrenia, and eating disorders, along with a composite measure, which is just mental health disorders in general. We then match these outcomes with a range of structural indicators from the World Bank and the UNDP, which is basically things like income inequality, unemployment, and everything that you see on the screen. So these tallies are especially useful because they capture both illness and disability, which gives us more of a complete picture of mental health loss across these countries over time. And the long time spans also help us reveal trends that the short-term data sets don't show or they're not able to. So we used what's called a two-way fixed effects model, and the idea behind that is actually it's pretty intuitive, where rather than comparing one country to another, which can be misleading because countries differ in so many ways, we compare each country to itself over time. So basically, you're essentially asking when a country's inequality goes up or down, or when its environment or its economy shifts, do we also see changes in mental health burden? And at the same time, the model also controls for global shocks that affects all countries, which are things like recessions or major international events like the COVID-19 pandemic. So those broader trends, so that these trends, they don't distort the results. In terms of variables, our outcome is mental health burden with DALIs, and our main predictor is income inequality using the Gini index. And then we control for these economic, social, and environmental factors that I mentioned before. All of the analysis was done in R with standard errors, which were basically adjusted for the long time series. So this makes the estimates a lot more reliable given the 30-year time span that we're looking at. And the reason that this particular framework matters is because it helps us isolate these long-run associations, which gives us a more cleaner picture of how these structural conditions and mental health move together over time. So across the 5 disorder categories, we see 3 main storylines. For depression and anxiety, income inequality is a very strong predictor of high burden, and these disorders respond very heavily to stress, social comparison, and feelings of instability. So this pattern is very consistent with the theory that we read during the literature review. Health spending also lowers the burden across the board, and urbanization affects them differently because increasing depression but lowering anxiety is probably due to better services in urban settings. And for schizophrenia and bipolar disorder, the environmental and economic factors take the lead. Air pollution contributes to a higher burden, and urban density increases schizophrenia risk. And for eating disorders, the negative coefficients don't reflect the true protective effects because they basically reflect the underdiagnosis of eating disorders in lower income settings.
Dia,
So
please conclude your presentation in another 1 minute.
oh, sorry. So I have a couple of slides. Okay, so when you put these findings together, the patterns make sense when you consider how each disorder typically behaves. Depression and anxiety track closely with psychosocial stress. Schizophrenia and bipolar disorder have stronger environmental and neurobiological components, and eating disorder results, they vary at different points. These findings have implications at several levels, from policy perspective, research, and in practice as well. So this study, I believe it contributes to a long-term integrated view of mental health in the G20 countries, which is something that has been missing from the literature. I've mentioned some of the limitations. I don't have time to discuss them, but even with these limitations, we think that this study provides a very useful foundation for understanding how these long-term structural conditions shape population mental health.
So great presentation, great work, Dia. So I would like to invite Dr. Khushbu Sahu.
No, Dr. Khushbu Sena. Dr. Khushbu Sena.
Sorry, Dr. Khushbu Sena. Yeah. To ask her questions.
So, since this is our paper and we work together, I would like either Dr. Niharika or Dr. Pooja or anyone else to ask questions.
Yeah, so that is why I wanted like maybe some other jury member, but anyway I'll ask her.
Yeah, can I,
Yeah, yes, Arun.
what is it that you think connects environmental pollution with mental health?
It was specifically for the schizophrenia, the air pollution index, there was a trend where as the air pollution had gotten worse, it contributed to more neurobiological effects, which are directly related to like symptoms of schizophrenia. So we
Okay.
wanted to look at more holistically. So instead of just taking instead of just taking the economic structures, we wanted to do economics, societal, and environmental to see how it all fits together.
So there were 2 or 3 different categories of mental disorders that you were tracking, right? So
Yeah.
environmental pollution in particular, you think affected, which types of disorders more?
The research showed that it affected schizophrenia the most.
I see. Yeah, Dr. Niharika.
So if you can go to your finding of the study slide. So you've written stronger economies enable earlier diagnosis. So when you say stronger economies, so could you tell me some specific variables of the economies which actually help in early diagnosis and better long-term engagement?
By stronger economies, it's countries that can actually afford to set up health centers in even rural areas, and it all basically comes down to how accessible care is. So when you're able to put more effort, more money into the healthcare sector, then that directly it corresponds to how people feel about mental health and about talking about these issues and even seeking help. And even in terms of the underreporting, naturally, if you don't have these centers, people aren't going to come forward and talk about these issues.
How did you quantify this?
Sorry, wait.
If you can go back to your data, I'll just go back to your
Yeah.
data analysis. Yeah, so this is daily income.
Well, access to care, we kind of related it to healthcare expenditure per capita.
Okay. Were you able to find it out for all the countries?
I mean, there was a lot of data for most of the countries because G20 countries, they tend to report all of these annually. But for the data that was missing, that was part of our limitations where we said that this study doesn't show a true causal effect, but there is a strong association.
All right. So I suggest, you can extend the study with more number of countries, and you can also actually, go with some comparative analysis of some South Asian countries and some developed countries like this, so just to extend your study. Otherwise, it's a great study. Yeah.
We wanted to do South Asian countries in the beginning, but the data was
Yeah.
hard, yeah.
All right. Yeah. So this is also one of the findings of your study that South Asian, they do not report it.
Yeah.
So this should be, yeah. All right. Yeah. Good work.
Thank you. Yeah.